Hello, I Thomas. Uh, so a hearing person let me know. Um, I live nearby. Let me know that the video where I am instructing physicians and also advanced practice providers, to introduce themselves to deaf, hard of hearing, deaf, blind, um, different things. So that the sound was not good on that. So I am recording again just for the benefit of the hearing medical dental community. Um, okay. So in deaf culture, we value clear, straightforward communication. So that means when we introduce ourselves, when we introduce, we introduce, we say, "Hi, I am," and I'm using my name as an example, "Thomas New Thing." And if you have a sign name, so I've been deaf since birth, and when I went through deaf school, my friends and everyone did this because um, my eyes had, um, well, the left eye, the left eye had ectotropia. The left eye had exotropia. That was very obvious. So, Thomas, and Thomas, I will always be. Okay, so, um, for physicians and also for advanced practice providers, the rules are the same. So you say, "Hello, I am," and then you say what your name is. It's important to know not to use a nickname or something like that. Um, so I had an appointment with with an ophthalmologist, and she was actually a vitreoretinal surgeon that trained in Baltimore, Johns Hopkins, with Susan, with Dr. Susan Bressler, and the clinic. I called the clinic and I let them know my name and my history, and I said I needed to be seen to be approved for something, and they said, okay, the name of the physician will be, and they used a different name than was on, uh, NPI affiliated name, professional name, because, I don't know if it's the physician's preference, but, uh, But I mean, it was an Asian name. It's Asian name. As a physician and a surgeon, that's her preference. But for deaf people and for our family, our children, we prefer to be given direct what the name of the physician is related to that person, that person particular role. Okay, so then you explain. So if you're an established patient in the clinic, you say, my name is da 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 da. I am, I am a nurse manager, or a nurse manager, or a nurse, or the head nurse for the shift, and different things like that. So, if you are a mid-level or an advanced practice provider, you the rules still apply. So if you are an ARNP or a DNP, okay, so that is not a physician. Okay, so ARNP. So I was a patient at a CS, and one of the advanced practice providers started with, was Vanessa, but it wasn't clear to me what the last name was, and so, I asked the front desk, what the person's name was, last name was, and the person at the front desk emailed me the last name, so I knew who I was working with. I've lived in Seattle, in the Seattle area for since March 11th, 2013, right? March 11th, 2013, when and I lived in an adult family home called your adult family home, and the DNP name was, no, I asked her if she was a physician. She said no. So I asked her, what are you? She said, I'm a nurse practitioner. Okay, so, I mean, I had to look at the prescription, the blister pack that they had, and I saw the name, DNP, after. So, and it is very important to clearly communicate the clinician's role to the patient, a patient who's deaf, deafblind, whatever, it's important to communicate that directly to the patient. Right, so we may bring a relative or a friend. I've certainly before in the past interpreted for friends at job interviews. Had they had phone interviews, so they wanted someone they wanted someone that sounded really uh, hearing. I mean hearing, 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 whatever. And was able to articulate everything about the position that they were working at, articulate it clearly. So, naturally, volunteer my service. And 2 out of 3, I then got jobs. It's always nice. So another thing is that so a deaf patient, they give you a sign, and um, that sign is a patient and a physician relationship. That sign is only to be used for work work professional purposes. So don't make the mistake that I did when I was, I don't know, maybe 4, 5, 6, I don't know, really young, and use a family sign and use someone's professional sign at a social event. Don't do that, because that's bad. Again, that's bad. So that's impolite. That we separate. We have separate for that. So for me, I'm not. I mean, I am still in college. I'm still in training. But I will always have the same thing. That, and it's not really accurate anymore either. Because it was established because my deaf school, I had this left eye is blind, but before, I mean, I had a really pink cataract, and so it went out. It had extra, yeah, and so now, so with the surgery, so I had surgery, and most most surgeons will say that my eyes, that they tracking well, or even sometimes that that so that it's the opposite. So it's the opposite. So it's esotropia. If the eye goes back, if the eye goes back, 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 if the eye goes up, 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 that's exotropia. And so typically, so for people who are watching this who are deaf, or just in general, so um, people, so people who are born sighted and they become blind as adults. So their eye tends to go up, up. But if you become blind as a child, that, I mean, typically, I'm not going to say, I'm not going to make any generalization, but um, my experience in general with, every week with other deaf blind, well, we had in Ohio, UTS. So UTS would student pick student 1, 2, 3, 4 pick and drive to Columbus, Seabus, and so my experience with the blind students that I rode with, they tended to have, they were born blind, um, you know, for various reasons, for various reasons, or became blind for various reasons. Um, so a lot of them would have uh, good tracking, or a few little kids, or had like exotropia, where the eye would go inward, different things. Um, for deafblind. So I'm not really. I don't have Usher syndrome, but I know many people at the deaf school who did. My youth leader, my youth leaders had a few different. A few of them were deafblind, able to drive during the day. Obviously, Usher syndrome, different person, different, different presentations, and Usher's, Usher syndrome, eventually leads to total blindness. But, but not always. Like, I know a lot of people with Usher syndrome. Um, a lot of people with Usher syndrome. And, like, some of them have, like, a little bit, like, a tiny field of vision. But, yeah. Anyway, so, thank you for watching this lesson. So, to recap, so when we introduce ourselves to deaf, hard of hearing, deaf blind, deaf plus, we always use first name, last name, and um, then we explain, what our role is. I'm sorry, what our role, not role. agent, but role is within the clinic, within the hospital, within the group home, whatever, or a day. I can't remember what it's called, but we always explain we always introduce ourselves with our first name, our last name, and we explain what our role is. Thanks so much for watching. Bye.